Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
The next type of classification is Forrest classification. For this Forrest classification is also a classification for upper GI bleed that is based on the endoscopic findings. So based on the endoscopic findings, we can calculate the rebleeding risk with the help of Forrest classification. So in the Forrest classification, we have three grades. Grade 1. Right. Grade 1 states that there is active and pulsatile bleeding is seen and there is high rebleeding risk is present for grade 1. In grade 2, there is non-pulsatile bleeding but it is just oozing and there is high rebleeding risk. And in grade this is grade 1b, sorry. In grade 1a, there is active pulsatile bleeding is present with high rebleeding risk. In grade 1b, there is oozing is present with non-pulsatile bleeding, that is grade 1b. Grade 2a is non-adherent visible vessel is present. Here in grade 2a, the visible vessel is visible and it is non-bleeding visible vessel is present and it has high grade, whereas in grade 2b there is an adherent clot is present and this adherent clot shows intermediate risk of bleeding, rebleeding. Then stage 2c, in stage 2c there is just a black dot is present, that means already the clot has been adhered and even contraction of clot is already seen. So as a result there is less risk of bleeding. And in grade 3 there is clean base is seen, and because there is clean base it has completely been healed, so there is low risk of bleeding. So overall we can say that the high risk of bleeding high risk of bleeding is present for grade 1, grade 1b, that is grade 1a, grade 1b, and grade 2a will have highest risk of bleeding. Then if you see, the lowest intermediate risk of bleeding is present for grade 2b, whereas low risk of bleeding is present for grade 2c, and grade 3 we have low risk of bleeding. So this is Forrest classification.
thank you and thank you for watching.